Good afternoon and welcome to another edition of CCK Live. My name is Emma Peterson and today I'm joined by Alex Sachs and Bethany Cook, and we're going to be talking about VA disability ratings for skin conditions. So Bethany, why don't you tell us a little bit about some of the common skin conditions that we see out there?
Some conditions that often get claimed are dermatitis or eczema, urticarias or hives, acne and chloracne, psoriasis, autoimmune disorders of the skin, skin cancer, and pseudofolliculitis Barbie. That's far from an exhaustive list, but these are some of the most common skin conditions that a veteran might claim. Often these conditions might manifest due to exposure. Many veterans are exposed to chemical or environmental hazards during their military service, and these exposures can lead to a variety of skin conditions like the ones that I named, which a veteran might be able to receive disability benefits for. But they can be caused by a variety of things. Pseudofolliculitis Barbie, for example, can be caused by shaving. And if these skin disabilities first manifest in service, that might be another route to service connection.
So let's talk a little bit more about that. Alec, how would a veteran go about getting service connection for a skin disability?
So the most traditional route would be through what's called direct service connection. And this really applies for all conditions, including skin conditions. And you need to establish three elements to warrant service connection for your skin condition. That's a current disability or a current diagnosis of the skin condition, an in-service event or injury or illness related to the skin condition. And oftentimes this is the skin condition itself beginning in service. And then third is medical nexus, linking the current diagnosis, the current skin condition, to the in-service incident or injury or skin condition itself. It's important to note that while it may seem obvious that your skin condition in service is the same as the same condition you have after service, VA really does require medical proof of that. They may favor medical evidence over your lay statements to that effect. So that's why that third element is often the most crucial in establishing the direct service connection for anything, including skin conditions. So there's also the avenue of presumptive service connection. So VA has determined that there are certain conditions that are presumed service connected to different things. The most common being herbicide exposure in Vietnam, right? Veterans who served in Vietnam who have the diseases that, or the skin conditions that VA has said are presumably related to that herbicide connection. And that's chloracne, which we talked about, and then porphyria cutanea tarda, kind of difficult to say, but that those have to manifest within 1 year of exposure to a degree of 10%. And as far as the porphyria cutanea tarda, since you've probably never heard of it, it's a rare disease. It's characterized by painful blistering skin lesions that develop usually in relation to sun-exposed skin. That's why it's often colloquially described as vampire's disease. So there's also the presumption for Gulf War veterans, an example being dermatitis. So veterans who served in the Gulf War may have dermatitis or chronic undiagnosed or unexplained illnesses, including skin disorders, that you may be eligible for presumptive service connection through your service in the Gulf War.
Now, what about for veterans that were in the second Gulf War? They were exposed to burn pits. Any presumptions for those folks?
For burn pits as of now, well, right now, the good news is legislation is moving through Congress that is aiding in this effort to relate similarly to the first Gulf War, these conditions that related to a lot of the same things that were happening in both. So that's in the works. We have some literature and videos, I believe, on that on our website, so you should check that out, our burn pit information online. But as of now, not yet for presumed service-connected conditions.
Okay, so the question then, we've gotten service connection. How does VA go about rating these conditions? And really, it boils down to distinguishing between how the condition affects a large part of your body, your entire body, or is it localized, and does it require localized treatment? So in 2018, VA made updates to all 15 body systems, including the skin. So it's important for folks out there who've had a skin condition pending for a while to take a look at both rating criteria, because one or the other might be more favorable to you, and you should certainly talk with your VSO, your accredited agent or rep or attorney, whoever you work with on your claim, to figure out which of the diagnostic codes is going to be better for you. But really, what, as I mentioned, what it boils down to is the surface area and the percentage of skin that's affected. So you'll go for a VA examination, and they'll use calculations. They'll calculate and take into account the surface area in inches, squared inches of the area that's affected. And then the examiner is going to estimate the total percentage of your skin that's affected. And so really, they'll look at that, and then they'll also look at the types of medication that you might be on. So Bethany, can you tell us a little bit more about how this actually pans out in real life?
Yeah, so the VA rates skin conditions under the regulation 38 CFR 4.118, and the diagnostic codes are from 7800 to 7833. However, most skin conditions are rated using the general rating formula for the skin, which includes ratings of 0%, 10%, 30%, and 60% based on severity. And like you said, Emma, the general rating formula determines the severity, what rating is appropriate, based on the treatment the skin condition requires, and the percentage of the body that the skin condition covers. For example, a 60% rating, which is the highest rating, is assigned if the disability causes characteristic lesions involving more than 40% of the entire body, or more than 40% of exposed areas affected, or if the skin disability requires constant or near constant systemic therapy, like corticosteroids, phototherapy, retinoids, or other immunosuppressive drugs over the 12-month period prior to the rating being assigned. Whereas in contrast, a 0% rating would mean the skin disability has required no more than topical therapy over the previous 12 months and characteristic lesions involving less than 5% of the body affected or exposed areas affected. And I think it's important, just because the rating criteria defines treatment in terms of systemic therapy and topical therapy, it's important to know what VA means by that. So VA defines systemic therapy as any treatment that is injected or taken by mouth, through the nose, or anally. And this includes, but is not limited to, the treatments that are specifically listed within the rating criteria. And topical therapy is, in contrast, any treatment applied directly to the skin, regardless of what type of drug it is.
Great. Thanks, Bethany. So Alec, what about scars? I mean, a lot of folks out there, a lot of veterans out there have scars that affects the skin. Is that going to be rated the same way, or is that rated somewhat differently?
Pretty similarly, scar disabilities also fall under the 38 CFR section 4.118 regulation that Bethany was just talking about. The diagnostic codes here are the beginning ones, 7800 to 7805. And scars are rated based on the number of scars or disfigurements that a veteran has, the area of the body affected, the distinguish between head, neck, face, and the rest of your body, their permanence, and the presence of pain or instability of the scars. So scars on the head, face, and neck are rated based on the skin loss, how many facial features or pairs of features, like your ears, for instance, are disfigured, or just the amount of disfigurements you have, ranging from 1 to 6, and that can kind of get you from the 0 to an 80% potentially compensable rating. And then ratings for scars on areas of the body other than the head, face, or neck are generally based on the size of the scar. So again, the 7-800 scars of the head, face, or neck rated based on tissue loss, distortion, or asymmetry of features, and that can range from a 10% up to an 80%. The more features or paired features affected corresponds to a higher rating. Scars elsewhere on the body that are deep and nonlinear located on, for example, an extremity or two separate extremities, or your back or torso, are rated separately, and they range from a 10 to a 40%. There are also superficial nonlinear scars, not on the head, neck, or face. And these max out at a 10% rating. These superficial scars are not permanent in nature. They don't affect the underlying soft tissue of the skin. And they're rated separately for each area of the body affected. And then painful or unstable scars. An unstable scar is one where there's frequent loss of covering of skin over the scar. If more than one scar is considered unstable, an additional 10% may be added to the rating. 5 or more unstable or painful can warrant the highest rating of a 30%, while 1 or 2 equals a 10%. And then other scars, including linear scars, the last diagnostic code that rates the scars, sometimes are rated based on the disabling effects the scar presents. So VA will look at other diagnostic codes to rate these. So if a veteran has a linear scar running along the elbow that prevents flexion, for example, VA might look to rate it under limitation of motion for the elbow.
All right, so the issue with skin conditions that can present difficulties is that each condition may have different causes and symptoms. Veterans might have multiple skin conditions, and they would run into a problem that VA calls pyramiding. It's a term VA uses for rating the same disability, same manifestation symptoms of a disability twice. So basically, there's no double dipping. So the long and the short is you can get multiple ratings, multiple DCs assigned for your variety of skin conditions, as long as each has a clear and distinct diagnosis and affects a different area of the skin. So, if you had, eczema on your face and, dermatitis on your feet, you might get different ratings for that. But if you had both eczema and dermatitis on your feet, you probably would end up with one rating if it affects your feet in the same way. And VA will look to see, which rating will give you the highest rating, because they do have a duty to maximize. That's just something that people should keep in mind, because oftentimes people do have more than one skin condition affecting them from their service. So that really takes us through just sort of the broad strokes of skin conditions. There are lots out there, and I certainly think they affect a wide variety of veterans out there. Before we sign off here, any final thoughts, Alec?
No, I know this was a lot of information, and it can be overwhelming, especially with, skin and scars. So many are very related, and a lot of these skin conditions probably never heard of. I've never heard of after, before practicing here, obviously. But just be sure to, make sure that your medical providers through either, the VA or privately, are just really presenting the fullest picture of the disability. And VA generally knows to look at to distinguish between the types of skin disabilities and scars, and they have these criteria in the back of their mind. But it's nuanced. It's a little, it can be tricky. So as long as you have that medically documented, it's going to help a lot in pursuing the claims.
I would just emphasize the importance of the compensation pension exams. Once you're granted service connection for the skin disability, that's really going to be how the VA rates your condition. Your private treatment records will be helpful, but they're really not going to, for the most part, give VA the information that they're going to use because they're not going to talk in terms of the percentage of your body that's affected. So make sure you get a copy of that compensation and pension examination VA is using, so that, if it does look like the VA examiner isn't accounting for every area that's affected, that you can combat that if necessary.
And just to piggyback off that, sometimes skin conditions will flare up at certain times of the year or under certain conditions. So you can try to push VA to get you an exam during a flare-up period, or you can provide lay evidence, explaining that, listen, I had just had treatment. That's why my skin condition was, totally normal the day of the exam, but in actuality, every month it flares up and it becomes extremely painful. And, lay evidence, picture evidence, statements from friends and family are all helpful. But As Bethany noted, and as Alex said, that medical evidence from the VA exam is going to be very important, especially for skin and scars. Well, thank you so much for joining us. More information about VA disability ratings for skin conditions and a number of other topics can be found at our blog at cck-law.com/blog. Be sure to follow us on social media to stay tuned into the latest updates in veterans law. Thanks again.